Hi, I'm Dr. Steve Tucker. I want to tell you about one of my favorite new tests. It's called 23andMe. It's a very simple saliva-based test that anyone can do. It's direct to consumer, and it gives you a whole set of information about your own DNA and biology. We order the test quite often for our patients and go through the results with them together. The information you get back comes in 4 categories. There's the risk of certain diseases. There's the, do I carry a gene that I could pass on to a family member? There's the traits, which could be, can I roll my tongue, or do I have a crease in my earlobe? And most importantly, there's the area called drug toxicity. Am I very sensitive to certain medications? The first 3 areas are important, but I don't usually call them actionable. The information about the drugs can definitely be actionable, as many people don't respond to certain medicines or over-respond and can have side effects from certain medicines. Sitting down with your doctor with this information can be incredibly useful. As an example, when we look at the disease risk, you might see something that says the average North American Caucasian has a risk of prostate cancer of, say, 18%. But you, my dear patient, have a risk of 4%. Does that mean my patient won't get prostate cancer? No. Does it mean the patient will? No. And what if the numbers are reversed and the average risk is 20%, but the patient's risk is 35%? Again, that's not a promise that my patient will get prostate cancer, but it's an opportunity for me to talk to the patient about how to reduce their risk of prostate cancer. The more information you have, potentially the more motivation you have to reduce your risk and engage in healthy behaviors. It's important to know when doing these genetic tests that there's a famous phrase, and I love to quote it, and that is, when it comes to DNA testing, genetics loads the gun, but it's the environment that pulls the trigger. So with that in mind, please keep engaging in healthy behaviors. Never be afraid to get more information. And as always, if you have any questions, send us an email. Thanks.